Hi, I'm Dr. Emily Poccia, naturopathic doctor and owner of Wildcraft Medicine in La Jolla, California. We've been talking about thyroid health and how it relates to fertility. Now we're going to talk about different treatment considerations when we are going to deal with different thyroid dysregulations. First thing to note, there are many different medications out there that interfere with thyroid functioning. Make sure you talk to your doctor about those different medications you're on and see if those are potentially an obstacle to cure or reasons why your thyroid may not be working as optimally as possible. So let's talk a little bit about some of the nutrients that are needed to produce thyroid hormone and make sure that it's functioning appropriately in the body. The first two major nutrients are iodine and tyrosine. So these are the backbones of thyroid hormone. One of the most common issues with hypothyroidism is iodine deficiency. Iodine is extremely important for thyroid production. In fact, T3 and T4 are named appropriately for how many iodines are in that molecule. So T3 has 3 iodines and T4 has 4 iodines. The other backbone to thyroid hormone is tyrosine. As tyrosine binds to itself, it creates another molecule called thyroxine, and that's the backbone of thyroid hormone with the different amounts of iodine attached. So making sure you have enough of these is critical. Then there are some minerals like zinc and selenium. These help convert T4 to T3, so those are very important. When we're talking about thyroid, remember we're talking so much more about this little gland. We also want to make sure that brain functioning is adequate, the gut, and the immune system. So in order for the thyroid to be functioning appropriately, we need also a proper functioning brain. In fact, the neurotransmitters serotonin and dopamine are critical for the release of TSH that go and stimulate the thyroid to produce thyroid hormone. Now, serotonin is a neurotransmitter that is produced mostly in the gut. So this means we also have to have a healthy gut. And these neurotransmitters are very important for mood. Dopamine is our pleasure neurotransmitter. It supports our kind of happy feelings. And serotonin is very calming and supports, if people have anxiety, they may have low serotonin is kind of one of the things that you'll see. In order to have healthy pathways of dopamine and serotonin, we need B vitamins to help our body convert all the precursors appropriately. Also, we need vitamin A. This is a really important vitamin that helps support thyroid hormone being able to bind to thyroid receptors throughout the body, and omega-3 fatty acids. These are the backbone to different hormone production. They support the brain, they reduce inflammation, very critical for thyroid and other hormones. So that's a little bit about some of the nutrients. You can get these through your food, you can supplement with them if you need to. Always ask your doctor about what's the right combination for you. But those are all really important nutrients that you'll see that's critical for thyroid health. Now let's talk about some herbs. So first we'll talk about herbs for hypothyroidism. One of the most important herbs for hypo is called bladderwrack. This is an herb that is a sea algae and is high in iodine. So this is great for people that especially have a deficiency in iodine. Then there's ashwagandha and Schizandra berry. These are both adaptogens, so they help your body adapt to stress. So ashwagandha also will help reduce inflammation, reduce cortisol levels, which is our stress hormone. It increases circulating T4 and actually supports fertility. This is a great one to use. Schizandra berry is also an adaptogen. This is an adaptogen that's high in antioxidants. It is stimulating and supports endurance. So for people that are experiencing fatigue, this is a great one for them to use. It also reduces anxiety, helps with insomnia and reducing heart palpitations. Overall supports cognition and memory. So this is a really great adaptogen to use, very tonifying to the body. There is Coleus Forskohlii. This is another herb that stimulates thyroid secretion of T4 and T3 throughout the circulation. It also helps with metabolism of fat, so for people that are having a hard time with weight and metabolism. And it helps with the binding of TSH to receptors on the thyroid, so that way the thyroid's actually being stimulated appropriately. Finally, as an herb called guggle, which helps support conversion of T4 to T3. So there's many herbs that help support an underfunctioning thyroid. Some herbs that support hyperthyroidism are lithosporum, lycopis, leonoris, and lemon balm, the 4 L's. So let's talk a little bit about those. Lithosporum inhibits TSH secretions and binding to the thyroid gland. That way it's not being stimulated to release more. The one thing to note about this herb is it's not great to use when you're trying to conceive, so it may not be the best option for you if you're trying to do that. Lycopis is an herb that inhibits T4 converting to T3. So you'll see less T3 in the circulation, which is what we want when there's overproduction of thyroid hormone. It also blocks the TSH binding to the receptors on the thyroid gland. It blocks autoimmune antibodies, which is great for things like Graves' disease. And it's good for people that have a rapid, weak heart rate. It helps to increase the contractions of the heart and the overall force of the heart. Then there's Leonoris. This is a wonderful herb that supports PMS symptoms, women who have delayed menses or lack of bleeding. This will help the body fully go through that cycle. It also strengthens the heart. It suppresses, it reduces heart palpitations. So this is a great one for just symptoms that are associated with hyperthyroidism and a great thing to add to the other 3 that you're using. And then there's lemon balm or melissa. This is a great nervine, so it's very calming to the nerves. It's also antiviral, which is great. But it blocks autoantibodies as well. It blocks TSH binding to the thyroid, and it prevents iodine being incorporated into the thyroid, which will block the production of thyroid hormone. So again, in a hyperthyroid picture, that's a good thing. We want to see that. So those are some of the herbs that support hyperthyroid. Now I want to talk a little bit about diet. So diet is really key and important here. Remember we talked about some of the reasons for thyroid dysfunction is infection, inflammation, food sensitivities, other hormonal imbalances, and stress. So we want to make sure that we're really looking at all these underlying issues when we are trying to heal and support a appropriately balanced thyroid. The number one thing when it comes to diet is avoiding gluten. Gluten is a protein found in many grains like wheat, rye, barley, and it tends to be inflammatory, especially for thyroid dysfunction. Hypothyroidism, especially autoimmune hypothyroidism, Hashimoto's, this is the number one thing to start with. Take out gluten, 100%. This will drastically help support balancing of the thyroid and help all the other things that you're doing work better. You may also want to avoid other food sensitivities you know you have. And you can find that out through food sensitivity panels or just doing an elimination rotation diet where you take major inflammatory foods out for some time, see how you do. Most of the time you'll feel better. You can try adding them back in one at a time and see if you respond negatively or positively. I also tell a lot of my patients to avoid dairy or limit dairy, as well as processed sugar. Alcohol is another one that you'd want to avoid. A great reference for diet would be an autoimmune anti-inflammatory paleo diet or AIP diet. This is a great reference. It talks a lot about taking out foods that are inflammatory, putting in foods that are anti-inflammatory, as well as getting good proteins to help stabilize your blood sugar. And that's the next point. Protein with each meal is very important. It doesn't have to be animal protein necessarily, but you do want to make sure you have adequate protein to help stabilize blood sugar and you don't have a rise and quick drop. This is going to throw off the brain functioning, this is going to increase stress and cortisol levels, and we want to keep that as stable as possible when we're trying to support thyroid. You also want a variety of different vegetables. You want to get good minerals and phytochemicals as well as fiber. One thing to note about vegetables and thyroid is that sometimes avoiding or limiting cruciferous vegetables for the hypothyroid patients is a good idea. So the cruciferous vegetables are kale, broccoli, Brussels sprouts, bok choy, cabbage, etc. There's a few more. These can interfere with the thyroid's ability to utilize iodine. So this may be something that you want to talk to your doctor about and see if it's worth taking out of your diet completely or at least limiting. Also, if you cook those foods, those tend to be a lot easier on the body and they don't interfere as much with thyroid functioning and iodine. For people that are have hypothyroidism, you may want to add more seaweeds and algae, which are higher in iodine. So that would be a great thing to add to your diet. If you have hyperthyroidism, you'd want to make sure that you avoid those. And finally, stress. This is probably one of the most important aspects to healing thyroid. It's also really critical and important when we're talking about fertility and preconception. This is a really exciting time. It can be stressful, but as much as we can do things in our life and our daily life activities to reduce stress, the better off we're going to be. So figure out what those triggers are for you. If it's traffic and rush hour, or kids screaming, or just all the different work you have to do and you're feeling overwhelmed, figure out what your triggers are and where you can have some control over things. Obviously, there's some things you can't control, and that's gonna happen. And if that's the case, then we have to add in tools that help us deal with that stress. Things like meditation, journaling, prayer, getting in groups with other women and just having time to kind of talk things out. Me time is very important, making sure to schedule in time where you just are by yourself or you have time to just reflect, doing things that make you smile, listening to music, dancing, whatever that may be. I also want to point out that relationships can be toxic. So looking at your life and who you spend your time with and figuring out, is there any major stress coming from those relationships? And if so, is it worth having that person in your life? So these are some things that will help support thyroid. It's always important to make sure that you're getting the blood work done, you're seeing a licensed practitioner that can really help guide you. Herbs and food as medicine is a wonderful way to address all these things, but even though herbs tend to be a safer route than medications with side effects, they can also be harmful if you're not using them in the right way. So always check back with your doctor. Hopefully this was helpful and you can support your thyroid and help support fertility. Take care.